Okay, now that we've talked about blood, we need to talk about how blood is pumped through the body. So we need to talk about the heart. So right now we're going to look at heart anatomy. So here's my heart. Obviously, hearts don't really look like this, but it's the best way for me to draw it. So in the chest, the heart sits in the mediastinum. It's not directly in the center. It's a little bit left of the midsternal line. The top of it looks like large like this, and that's called the base. And the bottom here that kind of goes down to a point is called the apex. Okay, the apex. The heart is divided into a right and left side. So here's the right and here's the left. And the right side is going to deal with deoxygenated blood, and the left side is going to deal with oxygenated blood. All right, so each half is further divided. There's like a wall between the top and the bottom of each half. So that, like that, kind of, and like that. So there's a space here and a space here, a space here and a space here. So this area here is called the right atrium. Below it here is called the right ventricle. Over on the other side, it's kind of like a mirror, we have a left atrium and a left ventricle. All right, so the blood travels between these two from atria to ventricle. So there are little sort of doors here called valves, and they are called AV valves. So AV valves, that is short for atrioventricular. So atrioventricular valves. The one on the right side has another name, and it's called the tricuspid valve because it has three like cusps to it. And then on the other side, it can be called the bicuspid valve because it has two cusps, and it's also called the mitral valve. So that's these two valves here. All right. So that allows blood to travel from the atria down into the ventricle. Those valves do. All right. For blood to enter the heart, the blood is going to enter the heart on both sides. Deoxygenated blood from the body is going to enter into the right atrium, and oxygenated blood from the lungs is going to enter into the left atrium. So if we start with the right atrium, do some blue here. So there's a big vessel that enters the atria from the above the body and below it. And this is called the vena cava. So we've got a superior vena cava that comes from like the head and the upper area, and then the inferior vena cava brings blood up from the abdomen and legs and all of that. So this is all deoxygenated blood. And it will come through here and enter into the atria. When the atria fills up or starts to fill up, the blood will be transferred from the atria into the right ventricle. Okay, we'll go through that AV valve and into the right ventricle. The right ventricle will then pump the whole heart will pump, but the muscles from the area of the right ventricle will force that blood through an artery called the pulmonary artery. So this would be the pulmonary trunk. I don't want to put that there. I'm going to run out of room, so give me a second. So this is the pulmonary trunk. And it will split into the right and left pulmonary arteries. So the right pulmonary artery sends blood to the right lung. The left pulmonary artery goes to the left lung. So these are going to the lungs. All right. So if you notice, I'm putting my deoxygenated blood into blue, okay, to make it look like it doesn't have any oxygen in it, because oxygenated blood is very red. So those are going to be in blue. So this is an artery, and it is carrying deoxygenated blood. So not all arteries carry oxygenated blood. All arteries carry blood away from the heart, but not all of them carry oxygenated blood, although most of them do. All right, so once the blood is oxygenated in the pulmonary arteries, then the blood returns to the heart through the pulmonary veins. And these veins are carrying oxygenated blood. So they carry the oxygenated blood from each lung back to the heart, and it goes into the left atrium. That blood is transferred down into the left ventricle. So it goes from left atria to left ventricle, and then it will pump the blood from the left ventricle into the aorta. So this is the aortic arch. So the arch of the aorta, blood comes up in here. It comes around and down back behind the heart, and then goes down to go to the body. So this would be the thoracic aorta. So the arch of the aorta, here's the ascending, and then the descending aorta. All right, so as it goes through the body, it's dumping off oxygen to the different tissues. So body tissues. And once the oxygen is released to the tissues, the blood is going to absorb or take on carbon dioxide to take back to the heart so that we can breathe it out of our lungs. So once we get through the tissues, then we're deoxygenated. And the blood heads back towards the heart. All right, so there are a couple things or a couple holes, I guess, sort of in the heart. Here in the right atria is where the coronary sinus is. Let's put the name over here. So a sinus is basically a big vein. So this is basically a vein that's dumping blood into the right atria that has been used by the heart. Now remember, the heart itself is a muscle. It needs blood, it needs oxygen, all of that. So it dumps its used blood into the right atria, and the aorta over here, this red, also has a little thing here, a little artery actually there, sorry, and that is the coronary artery. And this will send blood to the heart. Okay, so the coronary artery sends oxygenated blood through the heart itself, so the heart can use the blood, so because it needs oxygen and all that. And then it takes its used blood and sends it through the coronary sinus, which is a vein, back into the right atrium. All right, the heart, and I should mention this, but again, the heart is divided in two. The right half deals with deoxygenated blood, and the left half basically deals with oxygenated blood. And that division in the middle is called the interventricular septum. Interventricular septum. And it has cardiac muscle in it. It's made out of cardiac muscle, and it contains the nerves that are going to stimulate the contraction of that muscle, which we'll talk about a little bit later. Anything else that we need to mention? No, I think that's about it. So that's the basic anatomy of the heart. We'll look at that. We'll look at it in the lab. We've got heart models in the lab that we can look at, and we'll go over it more specifically. So I know this looks like kind of a mess, so just, start over, draw it yourself, and go through it. And just make sure that you know how blood travels through the heart and when it's oxygenated and when it is not oxygenated.